Hey guys, Brendan from Cyclists PT. I got a question recently about IT band syndrome in cycling, and what are some of the best exercises to deal with that condition that can lead to knee pain, pain on the outside part of the knee when you're riding, even when you're running, walking around. So I wanted to give a quick couple-minute video just to go through some of my favorite exercises that I tend to throw at this condition, and then, if there's issues beyond that, definitely consult with your local PT or give me a call. But in terms of the exercise, so IT band does two things. It's not very good at either of them. It helps to sort of flex the knee via the TFL muscle that it attaches to. So it flexes the knee and it abducts the hip, kicks you out to the side. So basically what we want to do is we want to help support it, give it a little more mobility into that area and strengthen those areas too, so that the stronger muscles can do their job. So the first thing we're going to do in terms of mobility is we're going to work on some flexibility in the front side of the hip, okay? So kneeling hip flexor stretch is probably my favorite stretch for this one, and that's where you're going to come into this sort of position. So the leg we're stretching is down on the knee. You're going to squeeze that bum muscle, tighten your belly muscles, and you're going to lean straight ahead, trying to get that stretch to the front side of the hip here, okay? You're going to hold it about 30 seconds, and then you're going to back off. And the second time through, you're going to do it a second set through. This time though, you're going to come straight ahead and you're going to angle a little bit off to get that front side corner. So instead of just the front of the hip, a little bit of that front corner of the hip right here. And again, sit in that for about 20 to 30 seconds. And that's going to stretch out our hip flexors, and it's going to stretch out that TFL muscle a little bit. So TFL muscle that I've mentioned, it attaches to the IT band. So think of like the TFL muscle almost like the muscle, and the IT band that runs down the outside part of your leg past your knee as like the tendon, okay? Again, 20 to 30 seconds here, and you should be pretty good to go, alrighty? The second stretch that I tend to recommend for this is to work on a little bit of the hip external rotators. And there's two variations. The one I like the most is like what I call the 90-90 stretch. So that's where if you're on a yoga mat or exercise mat, the shin you're stretching is kind of along one edge. The opposite shin is facing towards the opposite edge, okay? So they're perpendicular to each other. And what you're gonna do here is you're gonna shift your body weight sort of forward over that front shin, and that should give you a nice stretch on the outside part of that hip, okay? So you might feel it right in the hip, deep in like sort of like the bum muscles there, the glutes. And you're just gonna sit in this for, again, 20 to 30 seconds. All right, and if you're feeling it on both sides, what you then do is you shift the legs, you flip them over, and then you shift down. This gives you a view of like the opposite side, what this should kind of look like. And depending on how mobile you are, you might be able to get your chest all the way down to the ground. If you're like me and you're tighter, it might be a little tighter than that, so not getting down quite as far. But again, 20, 30 seconds in those two positions, okay? That's the mobility, but the key here is stretching is gonna get you so far. We need some strength, okay? So the first thing we're gonna do is hit those glute muscles. I like to use a band if you have a band available. If you don't, you can probably modify this without. Band's gonna come up around our knees, okay? We're doing some bridges here on our back. Feet are hip width apart, okay? And you're gonna lift the hip up, squeeze those bum muscles, then lower back down. With these bridges, do not let your lower back muscles do all the work. Really make those glutes, hamstrings work here, kind of peeling your bum up off the mat, all right? Aiming for 10 of these at least, and going for 2 sets, okay? Once these get to be a piece of cake, you can either get a tighter band, or you can start adding in a single leg variation. So kicking that leg out straight, working all one side. Just make sure it's nice and stable. You're not shifting too much. You're not dropping your hip down. And that's just gonna work one side more than the other. So bridges with the band around the knees to start. 2 sets of 10 at least, up to 3 sets of 10. When it gets easier, start to add that single leg variation, okay? So that's the strengthening there that I would work on. The other strengthening exercise that I like a lot for this one is, again, to kind of hit those external rotators. So again, you can use the band around the knees if you'd like, but to start off, I usually recommend starting on our side here. And we're gonna work on is coming into a side plank with our knees bent, and then opening up into that clamshell. Coming back down, and just counting off so you're keeping that bottom leg up, bottom hip up, 10 to 15 clamshells here, okay? And once you get those 10 to 15 clamshells in, as you might have guessed, you're gonna come back down, flip it around here, 10 to 15 on our other side. Okay, so coming up, 10 to 15 clamshells here. So that's gonna be the 2 exercises and 2 stretches that should hit some of our low-hanging fruit, that if you have some IT band syndrome, these are good exercises to throw in, whether you're running, cycling, just having this pain day-to-day basis. But throw it in like 3 to 4 times a week to start. Even every day you could do these ones, they're not too intense. So add those into the routine, see if it starts to move needle. And if it gets you part of the way, but not all the way, definitely consult with a PT in your area or give me a call here at Cyclists PT. We can get you going and hopefully get you feeling stronger.